Good evening, Asia. Good morning to all of you in the Americas, and good afternoon to everyone logging in from Europe. Welcome to the University of Chicago, Francis and Rose Ewan campus in Hong Kong, and our first global conversation live event, 100-Year Lives in Asia, with Professor Kate Cagney. My name is Mark Barnico, and I'm the Executive Director of the University of Chicago, Francis and Rose Ewan campus here in Hong Kong. The Ewan campus in Hong Kong is the premier location in Asia, which represents the University of Chicago's values of free and open discourse, rigorous debate, and exchange of ideas. Here in Hong Kong, we offer our #1 globally ranked Booth Executive MBA. We host and teach several of our study abroad cohorts from Chicago. We facilitate internships for our students, and we host University of Chicago faculty to lecture and collaborate with their peer scholars and communities throughout Asia. For more information about our activities on the Ewan campus in Hong Kong, please check out our website at www.uchicago.hk or follow us on the U Chicago Ewan campus Facebook page. During these unprecedented times, during which we are experiencing COVID-19, we have developed new online events under the Ewan Lecture Series banner. Tonight, we're delighted to have a very special Ewan scholar, Professor Kate Cagney from the University of Chicago's Sociology Department, to host the first of several episodes of our program, 100-Year Lives in Asia. Tonight's conversation topic is social relationships during COVID-19. The 100-Year Lives in Asia program will discuss more than aging and the elderly. The program was originally conceived to respond to the need for us to rethink the arc of a single human life as it relates to one's education, career, retirement, health, financial security, family structures, and social connections, as well as government policy in a world where people are living longer and more prosperous lives. But that was before COVID-19. With the coronavirus having turned our world upside down, several episodes of this new series, to be broadcast every 2 weeks, are focused on our new reality and life in the context of COVID-19. Our second episode on May 14th is titled Health and Life Expectancy. Please plan to join us for our next online event. Now I'd like to get to the program and introduce the chair of 100-Year Lives in Asia, Kate Cagney. Professor Cagney is a professor in the Department of Sociology at the University of Chicago and the director of the Population Research Center, NORC, and the University of Chicago. Professor Cagney's work examines social inequality and its relationship to health with a focus on neighborhood, race, aging, and the life course. Professor Cagney has developed a series of research papers on neighborhood social capital and its relationship to outcomes, such as self-rated health, asthma prevalence, physical activity, and mortality during the 1995 Chicago heat wave. Currently, Professor Cagney works on 2 Chicago-based studies of neighborhood context and older adult health, and is examining the role of social and physical environment with the National Social Life, Health, and Aging Project. She recently received funding from the National Science Foundation to examine older adult well-being during and after the COVID-19 pandemic. Please join me in welcoming Professor Kate Cagney.
Thank you, Mark, and I'm delighted to be here. Social relationships in COVID-19 aims to examine how we relate to one another and how our relationships might be enriched, altered, or experience fundamental change during this pandemic period. We have the benefit of 2 experts to guide our thinking about such circumstances today, with attention to aging in the life course and relationships between and among generations. So let me tell you a bit about our speakers. The first is my colleague, Linda Waite. She is the Lucy Flower Professor in Urban Sociology at the University of Chicago. Her research examines working families, marriage, sexuality, aging in the life course, and health. She directs the National Social Life and Health and Aging Project, a longitudinal study of health and well-being among older adults. Since joining the University of Chicago in 1991, Waite has led a number of initiatives, including the University's Center on Aging. She has served as president of the Population Association of America and was the 2012 recipient of the Matilda White Riley Award from the Office of Behavioral and Social Science Research at the National Institutes of Health. She is a recipient of a Merit Award from the National Institute on Aging and was inducted into the American Academy of Arts and Sciences in 2018. Welcome, Linda. Xiaoli Tian is associate professor in the Department of Sociology at the University of Hong Kong. She received her Ph.D. from our Department of Sociology at the University of Chicago in 2011. Her research interests include how pre-existing knowledge paradigms and cultural norms influence the way people respond to unexpected transformations of their everyday routines. She's written extensively on various forms of online interactions, including emails, blogs, online literature. We can imagine it's very important in our context today. She's looked at that primarily in China, but more broadly, looking also at social media, online shopping. Her most recent research examines how Chinese urban youth interact on WeChat and the impacts on social relationships. Welcome, Xiaoli. Hi. So Linda will start us out today, and she's going to help us frame social relationships in the context of COVID. Then we'll move to Xiaoli. Then we're going to have a conversation amongst all of us. Thank you, Linda.
Hi, thank you so much for having me, and it's nice to see everybody, even if from a distance. The topic of today's webinar is social relationships, and it's obvious to all of us that human beings are quintessentially social animals. We live in small groups, we evolve to live in tribes and extended families, and we do best when we're well embedded in social relationships and social groups. In fact, the social world is so important that in 1947, the World Health Organization included social health as a component of health, along with physical and psychological well-being. To understand the social world, especially at older ages, and in a rich way, and its relationship with physical and functional, cognitive and mental well-being, a group of us at the University of Chicago, which I head, started a study, the National Social Life, Health and Aging Study, of which Professor Cagney is a part, to measure very, very carefully various components of the social world and to measure the other components of people's well-being, their backgrounds, and to see how these all connected, and also how they change for individuals as they age. We started in 2005 with just over 3,000 community dwelling older adults in the United States. We spent a long time in their homes gathering information on many features of their lives. I'll outline those really briefly. And we went back to them 5 years later to see what had happened to them. And we interviewed them 5 years after that. So we talked to everybody who was healthy and available, but that was almost everybody in 2005, 2010, 2015, and we intend to go back to them. We intended to go back to them this summer. That will be put on hold during COVID-19. And I'll tell you a little bit about what we're planning to do in the interim, specifically on COVID-19. The NSHAP was joined about 8 years ago by a sister study, the Korean Social Life, Health and Aging Project, which uses many of the same ideas, has a somewhat different approach, but also tells us a good deal about the social world, in this case, in one rural farming village in Korea. But in that case, they talk to everybody in the community, which is a different way of doing things. We couldn't talk to everybody in the US, and brings a unique focus to social relationships. I'm going to mention here, and the things that I think are the that scientists think about as the most important components of social relationships include social networks, the people that you talk to all the time, the people you're connected with and who are often connected to each other. These social networks, the groups of people working together, affect your health in some surprising ways. I'll give you a couple of examples. Of course, we study marriage and other intimate relationships. They are, for most people, their closest, most longest lasting, most intense, most important social relationship. Social participation, what do you do with other people and groups, is also very important. Social support, who you can count on for help when you need it, and social strain. Who do you have maybe a somewhat negative or sometimes negative or strained relationship with? And all of these different kinds of social relationships act in different ways. And you don't need all of them to be fabulous. There's suggestions you can substitute if you don't have so much social support. You can, from people around you, you can rely on your spouse more or people in your church. But all of them are important and in different ways. We also look carefully at social isolation and loneliness, which are, I think, particularly important during COVID-19. Social isolation is the objective connection to people around you. Who's actually do you live with? Do you do things with? Do you have a spouse? Loneliness is the sense that your social relationships are not enough, that you don't have all the social relationships you would like to have, and they're not functioning as well, that you're not a member of a group like you'd like to be. Sometimes you don't have people to do things with. And we expect those to change. We know they changed. Certainly we know social connections, social participation, social engagement has changed. And we expect that loneliness has changed as a result too. So a few things we found that I think help us think a little bit about social relationships in the time of COVID-19. We have thought for a while that as people age, especially as they get into older ages, they start pruning their social relationships. This is called social emotional selectivity theory, and it suggests that as people lose, as they retire, as they face health challenges, as they get older, they restrict their social relationships and their social contacts more often to a small number of very central people. We in NSHAP have not found that to be the case, which I think is very good news for the resilience, the social and emotional resilience of older people to COVID. We found, in fact, that as people get older, they more often lose a spouse, somebody from their social network becomes unavailable, they themselves are not as able, but that it seems most people substitute kinds of social relationships that they can control, like participation in church or in volunteer work, for the ones that they lost that they couldn't control. So they seem to be about as socially active. Some new research by Ben Cornwell and Ed Lauman shows that over the years we've been talking to our respondents, they almost always lose somebody from their social network over that time. But even as they reach older ages, people tend to maintain the same kinds of social relationships. If they lose a relative, they bring in another one. So that social relationship, the quality and the number of people in their social network changes very little, which is also good news. When things change, most people adapt to get back to where they were before the change. The other challenge that many older people face is that they have a health event or their health declines. They develop a chronic disease or their functionality gets worse. We were concerned as researchers that that could mean that in marriages, older marriages or intimate partnerships, poor health affects, and we know it does, affects the functioning of the relationship. If somebody can't carry out the same roles they always carried out, then that could be a problem. So we examined marital quality in couples and compared those who had a decline in health with those who did not. And among those who had maintained an active sex life. We found that staying connected sexually protected older adults from the decline that happened in the absence of that to other adults, the decline in marital quality. So one way these older adults acted to keep their connection strong in the face of loss was to remain sexually active. Social networks are key in health, both because people draw on them for information. People talk about their health challenges and get advice from people in their social networks. Working with colleague Erin York Cornwell at Cornell, she and I compared the health treatment that people were getting for hypertension. And we found that a larger social network was not helpful in getting people better medical care unless they talked to the people in the network about health, in which case it did. I guess the last point I want to make about a NSHAP study that has implications here is that there seems to be a link between cognitive function, which we measured in NSHAP, and social participation, and it's different for men and women. So women who have some cognitive limitations see some smaller shrinking in their social networks and their social participation, whereas men do not, perhaps because others come into the family to help the men who are having a hard time, including the wife. So in a little while, I understand we're going to talk more explicitly about how social relationships might be different in the time of COVID. And in response to questions, I'm happy to tell you lots more about this study. But I think that's a good point to stop.
Great. Thank you, Linda, for that terrific overview. And now we'll ask Xiaoli to come in and tell us a little bit about her work. And I know, too, you're going to focus some on how we might connect electronically, in a time when we can't necessarily connect face-to-face. So thank you.
Thank you for having me here. It's really great to see all of you here. So in terms of social interaction, there are two major changes in the context of COVID-19. So the first one is that people are forced to stay at home. We all know that. We're doing that. So in Hong Kong, many elderly, they live with family members. So during this period, they might get to spend more time with those family members. But I'm gonna focus on the second trend. So because of the lockdowns and social distancing, many activities and social interactions moved online. Online teaching, online shopping, online research seminars, online parties and gatherings. For example, this particular online conversation wouldn't be possible before the pandemic. It would be held in the Yuan campus located in Mount Davis, Hong Kong. So online interaction becomes the new normal in the context of COVID-19. Then how should we understand this rapid increasing of online interaction? So before I answer that question, let's step back a little bit. In the pre-internet era, most human contact with others rely on face-to-face interaction. In contrast to face-to-face interaction is mediated interaction, and that's interaction carried out using information technologies. So mediated interaction existed before the internet, such as writing letters, or we use telegrams and telephones to communicate with others located in another space. Mediated interaction has long existed, but never as pervasive in everyday life as it is today. So online interaction has become so pervasive that we can no longer assume that face-to-face interaction is the prototype for social interaction. We all know that online interaction cannot replace face-to-face interaction, and the strength of face-to-face interaction is obvious, so we don't need to say much. But how should we understand online interaction? Is it just a substitute when we don't have the option of face-to-face? Indeed, in the past, mediated interaction was regarded as a lesser form of interaction, and this is particularly true for Goffman, who is a very famous sociologist. So he believes that face-to-face interaction is the best, and mediated interaction are lesser forms of interaction. And that's because mediated interaction usually do not have enough visual cues or body, you cannot see the body language and the tones. And especially in the earlier years, a lot of mediated interaction are dependent on text, they're text-based interaction. And often mediated interaction is asynchronous, has the problem of asynchronicity, which means you cannot get immediate response from the interacting others. However, such problems have been remedied by the increasing technical affordances of digital technologies. For example, free internet video calls allow for a virtual copresence like what we're doing right now with others who can be in another place. And that solves the problem of dependence on text or focus of attention. We can see whether each other are focused, and also solve the problem of asynchronicity. But online interaction is indeed different from face-to-face interaction and has its own distinctive features. And the most salient difference is the lack of physical copresence. Face-to-face interaction occurs in a physically shared and coherent and bonded and unified space. But online interaction are liberating exactly because it does not require physical copresence, because it overcomes the spatial and temporal boundaries of face-to-face interaction. And that's what we call ubiquitous connectivity. And this is a big advantage. And people have easy access to their primary groups or social support anytime. Earlier, Professor Waite mentioned how important those primary groups and social supports are. And now with online interaction, it made it easier. For example, in my pastoral study, I had a case, I encountered a case, a student was on his way to renew visa in Hong Kong, but he lost his phone and wallet. So he had nothing. And then he went to a public library nearby and used the computer there and sent a message on his Renren account. And then in 1 hour, someone who is working in a building nearby, in an office building nearby, went to the library and lent him the money so he can get his visa renewed. So those kind of stories, and there are a lot of those stories in my research. So another advantage of online interaction is that many users feel that it's easier to do communication control. So that means to control how and when they respond to others. Mediated interaction allow asynchronous interaction, and therefore there is more time to respond and there's less pressure. Even in synchronous and quasi-synchronous interaction, such as instant messaging, users can still manage communication pace and the length of interaction time. Asynchronicity can also reduce misunderstanding because earlier discussions can be revisited and there's more time and discretion are available to elaborate on the content. And this helps to release the pressure and the stress usually found in face-to-face interaction. For example, when we changed to online teaching this semester, I was at first not sure about how that's gonna influence the quality of teaching, but soon I find that's actually not that bad because students are active in participating discussion, even more active than normal teaching in a classroom. And you have to put this in the context because here in Hong Kong, a lot of students are pretty shy. So at the end of the semester, which is last week, some students confessed that they feel more comfortable sharing their views online than offline because others cannot see their faces and they can only hear them. So they're like, oh, you know my voice, but you don't know my faces and you don't know my face. So their invisibility to others really reduced the pressure. Lack of physical copresence also leads to certain level of anonymity and invisibility. And that means conventional status symbols, such as physical appearance, are less accessible and visible online compared to face-to-face settings. And like in my study of online shopping, I find that a lot of Chinese customers prefer to do online shopping because in offline shopping in a physical store, and they have to engage in status performance in front of the sales agents. So that's a lot of pressure. But online shopping, they don't have to do that. And also research also confirmed that the lack of visual status cues result in reduced effects of gender expectations. So the lack of visual cues make it possible for users to focus more on inner thoughts and ideas rather than looks. So this is also based on empirical research. In terms of relationship quality, research showed that social media use help form both bonding and bridging social capital because online interaction can facilitate building and maintaining large number of both strong and weak ties. Like it's easier to maintain large numbers of both strong and weak ties. And many urban youth that I studied believe that online interaction can facilitate the building and the maintenance of offline relationship. And they have all kinds of strategies to do that, like especially on WeChat. They're very careful with their WeChat posting and liking and commenting activities just to maintain their offline relationship. So online interaction is not a lesser form of interaction. It's different from face-to-face interaction, but has its own advantages. Of course, there are new constraints as well. In my opinion, like online interaction should be regarded as an alternative to face-to-face interaction. It creates new possibilities for human beings to improve relationship quality, especially during like the global crisis, like what we're facing right now. That's all I have for now. So maybe later we can discuss more on how this is, like what are the new things that people came up with during the, this pandemic.
That's great. Thank you so much. And I love your point on mediated interaction and this idea that really over time we've often had, right, some way in which our interactions with one another are facilitated or translated, if you will. Linda, I wondered what your comments were on that.
Well, first of all, when you have a social network,
yeah,
you don't need to speak to them face to face. In fact, most often, I think the communications are a quick text, an email, a phone call. And so lots of people have network members who are far away. They speak to them or FaceTime or Zoom or email frequently and are very involved in their lives, but it's not face to face. I've heard recently of Zoom religious services. For Passover, groups of families sometimes had Zoom seders or Zoom weddings, or so it's not ideal probably for some of those things, but it's a lot better than nothing. So I think that social participation doesn't have to be in person. All of it doesn't have to be in person. And we've shifted more toward the mediated, even in, you know, parent and adult-child relationships, or intergenerational, or people's relationships with and contacts with their grandchildren. A lot of older adults are nervous about having young adults or younger people coming and going in their home, and the younger people don't want to expose them. So there's more distancing across the generations for the safety of the older adults.
Xiaoli, you've spent time also thinking about the younger generation. So I wondered if you wanted to draw out Linda's point. How do you think that these practices change relationships between or among generations? Do you think there are opportunities for teaching, right? How to imagine sort of creating a reservoir of social capital, if you will, and then how to activate it with some of these technologies. Just wondered if you might wanted to comment.
Yeah, I mainly study like young people, but sometimes they talk about their intergenerational relationship, especially with parents. I think it's different with parents and then with grandparents. With parents, they are more like, they usually, their parents also are very active users of social media, such as WeChat, especially WeChat. It's almost like everyone is using WeChat in mainland China. So sometimes they would mock the content their parents shared on WeChat. Like some parents would send them all kinds of healthy information, like you can eat this and you cannot eat that. And sometimes the news with like what they would think those are like news with sensational titles. But so they would mock those content, but they understand that it's just a way for their parents to stay connected with them, especially if they are not there or at university or in another city. So I think it's definitely provide another channel for parents to stay connected with children. And also a lot of families have a group chat, like WeChat. They build a family group. So, and that's, as Linda just mentioned, you know, if it's a primary group, if you already have a social network, you do not have to always meet them. So they have very active online chat in this group chat. They would announce like a recent changes in their life, or you have chat about some recent events and etc. It's very, they kept the family life very active. Yeah, and then another thing is with grandparents, I think, well, with grandparents, they tend to show more like passion. So because with parents, there is still has some kind of tension for young people. But with grandparents, it's more like, sometimes they like to show their grandparents some stuff online and or teach them a little bit. I think that's really a good way to spend some quality time with family members, with older, the more senior people.
Yeah, and I think we've all had this experience, right, during this period of time of learning new technologies quickly. For myself, certainly Zoom. And Linda, I was thinking too about some of our findings from NSHAP and our colleague Martha McClintock and her interest in things like touch and the extent to which some of these forms of connection are still very important, but there is something about intimacy. And what are your thoughts on that? How do we think about still connecting and still drawing out that intimacy, even if, again, we can't be next to one another?
Let's think about marriage.
Yes. Yeah.
So I think the situation is fundamentally different for people who have an intimate partner or a spouse, cohabiting partner who lives with them. Then their situation during COVID has changed so that they're spending more time together. They're maybe not leaving the house at all, and they're with each other 24 hours a day when they didn't, and they have fewer things to do because sometimes work has ended, or they can't go out and do the other volunteer activities or go to church. Or for many couples, and remember, most married couples rate their marriages as very happy or extremely happy. I think it's something like 80% or 85% of married couples say they're very happy or extremely happy. For those couples, I think it's very possible that that COVID and this forced time to stay together gives them opportunities, and in fact can deepen the relationship. There are just more things you talk about, more things you work out. And I also thought about the news about the pandas in a zoo who had been together for 11 years, something like that. And only when the people disappeared and they had some peace and quiet did they finally consummate their relationship. So it's an opportunity to do those kinds of things for people in a close relationship. For people who when you want to connect to people who are not living with you, I've been speaking to my siblings on the phone more. Mm-hmm. We've been having more group texts or WhatsApp. So I think people are just checking in more because they want to know how everybody's doing. So I think there's been an increase as other things fade away, your other demands. I don't as often say, you know, oh, I've got to walk over here. I've got to walk over to a meeting. So I have a little bit more time to take a phone call, or if I get a call, to spend some time on it. Let me stop there because I want to hear to what Xiaoli says about this.
Yeah, what do you think?
So I agree with Linda. It's like a lot of things that happened during this current, like things surprised me actually, like online wedding and online party, right? Because in symbolic interaction, or like in social studies of like micro-sociology, there are scholars, like theoretically, they were trying to redefine copresence as a concept. They're saying that, okay, physical copresence does not mean like really copresence, because you can be physically together, but you can focus on different things. So there's a intention, synchronicity, whether there is a synchronicity of attention or emotion and behavior, right? So they were trying to redefine copresence theoretically. But before this pandemic, I think it's still more like a theoretical discussion. Like, but now we can see there are more and more empirical examples of this, like a Zoom party. Like people just hang out in front of a computer, and they drink their own food, they drink their own wine and eat their own food and listen to their own music. They may share a music, I heard. Yeah, so this kind, that's really redefined what copresence is. I think that's a pretty big change.
I went to a Zoom funeral weeks ago, and it was the first time, and I thought, in fact, it worked amazingly well. There were more than 200 people there. Everybody could see everybody else. Everybody had a very close view of the mourner and the people conducting the services, and they even took us to the cemetery during the interment. I thought it worked very well. And lots more people could go because they didn't have to drive for an hour, and it was pouring rain. So,
and I think that's an excellent point, that there are ways in which people can now engage in these sorts of, social gatherings of formal and informal manner in numbers that we've never seen, right? That there, and for people who, possibly for health-related reasons couldn't make that kind of trip, can now be, right, central to the way, to the grieving process. And I think that's critical.
Yeah,
if you think about other kinds of social groups, one of the things that's happened, we've seen it in Italy with people going outside and singing.
Yes.
And in some places, I'm thinking particularly of Israel, when there was a major holiday a couple of weeks ago, there was a formal invitation to go out to your garden or your balcony at a particular time, and families and everyone sang one of the songs connected to the holiday. It warms my heart to even talk about it.
Think about it. Yeah.
Humans are inventive, and this is social participation. It is even face-to-face social participation.
Great point.
You're never closer than 6 feet to the people you don't live with. So it's amazing and really heartwarming how inventive people have been to develop these new social behaviors that are just lovely.
So on that point, so SARS in 2003 changed many of our social practices for good. And so one example is that in Hong Kong, disposable chopsticks have been more common. People wear masks if they have flu or cold. That's prior to the COVID-19 experience. Do you expect any of these long-term changes from COVID-19 and social practices, how people interact? We're kind of giving some examples now, but even imagining things like handshaking, hugging, kissing one another on the cheek when we greet. What might you imagine would come from this? Xiaoli, you want to jump in on that one?
So we don't know yet, like how COVID-19 is gonna end. So I'm hesitant to make any prediction whether we're gonna abandon handshaking or hugging. But I think one of the change might be like attitude towards mask wearing. I think that might be the major change from this current pandemic. Yeah. So now wearing masks become a civil duty. It's not just it's to protect yourself, it's protect others, and to protect the environment, the places that you go. So I think that's gonna I think that's gonna be one of the major changes.
Imagine too that people will become more willing to say something to somebody who appears in public very sick with a cold, coughing, sneezing, blowing their nose, who doesn't have a mask on. Even under ordinary circumstances, you shouldn't spread that to other people. And we have more, I think, more sense of how easy that is, and it's the responsibility of the sick person to protect other people if they're going to go out in public at all. I can see also airlines, JetBlue is requiring masks, and I can see that they might carry a stock and give them to anybody who's coughing a lot or blowing their nose.
And perhaps just more generally, on your point, Linda, thinking about how our own behavior affects the collective in a way possibly we haven't been so attuned to before.
So do you think it could affect willingness to vaccinate when we see how one person's contagiousness affects so many of the people around them?
Yeah, that's an excellent point. And I hope someone is writing that paper. Right? I hope someone is tracking that now, maybe you. We have about 15 minutes left together. So I'm going to turn to some questions that are coming in from our listeners. So one is actually, Linda, I'll share this with you. One listener asked, how is older adult defined in NSHAP? And is it an intention to avoid the use of elder or elderly? How do we think about the nomenclature around aging?
Well, remember, getting older is just a part of the normal human life course, and we're all fortunate to reach older ages. And it has many benefits. Getting older has many benefits. We know pretty clearly that older adults are at least as satisfied with their lives as younger adults. A lot of the things that people worry about have gotten settled, and people have made their accommodations to the disappointments and the successes. And we know that on average, as people get older, they get better at managing their emotions. So they don't get angry as much. They don't yell as much. They don't get upset about the negative things as much. People who've been married for a long time to figure out ways to manage, avoid the things that they disagree about that are problematic, and to relax about the things about their spouse that maybe make them nuts, and to look more on the positive. So in NSHAP, we defined our sample as beginning in the mid-50s, people who were in their mid-50s or older. We included people up to age 85 because we became concerned about, we hadn't done this before, we were going to be in the home for 2 hours, that we were concerned about the burden on people older than that of carrying out the interview. Now, the truth of the matter is, when we went back to people, we got as many of the people who are now 90 who did an interview at 85. So the many older adults in our study really enjoyed the experience of having some nice lady come and talk to them about themselves. So elderly seems to imply quite old, where older is just that whole broad spectrum from middle age to older. So older is nice because it indicates what part of the life course you're talking about, but is vague about precisely which part.
Right.
And the National Institute on Aging also has definitions. 65 to 75 is young old, 75 to 85 is middle old, and 85 and older is oldest old.
Right, but I think that underscores, right, that there are these distinctions even when we're making a cut point of sorts, right, that we're still thinking of the arc of a life, right, and that there are these distinctions even, right, at a later life stage. Xiaoli, you do so much work on technology, and just thinking again as we're thinking about the relationship between generations, do you think there are differences, this comes in from a listener too, in the patterns and preferences for older and younger adults working from home, adapting to this kind of technology? One listener asked about, what do we know about how students are feeling about online teaching? What are the ways, that people are adapting, and are there differences across age and generation?
Unfortunately, I don't have data to
You don't really have data yet, I guess.
Yeah, right.
Yeah.
So it's usually assumed that younger generation, they adapt to technology faster, like more, and they're more willing to. Like when we were asked to switch to online teaching, I have to confess that I was quite reluctant. I like the face-to-face, but no other choice. So we all have to do this. In terms of the online teaching, I would like to clarify a little bit, because I think I saw a question coming in. So I'm not saying that online teaching is I'm not saying that it's positive attitudes of online teaching is very popular. I'm just saying that there are certain strengths of online interaction, and that's reflected in this one aspect of online teaching. And of course, there are a lot of complaints about online teaching, like including myself. And from the student side also, like students do not get to meet other students, they cannot form a community, and those are important for university life. And also the increased social inequality, because some students Like we have students all over the place. I have a student living in Africa, and she have very hard time getting connected.
Great point.
That she's always coming in and on and off, and that's why I recorded all my Zoom lectures and send to her, because she really can have problem with connection. So there are online interaction also have all kinds of problems. But I'm just saying that it's different from face-to-face interaction, and this particular like invisibility, and especially in the Asian context, or more like specifically in Hong Kong context, because here we have our students. A lot of students are pretty shy and they're afraid of speaking in front of a lot of people. So they find it's easier to express their ideas and don't have to worry about losing face in public. When it's, because we always, as professors, we always encourage them to use videos, but they never use video. I think it might be, I'm sure it's quite different in the US, right? So I don't know about your experience.
But that brings me actually to a question from a listener about cross-cultural differences, differences between East and West. We have listeners from all over the globe with us today, which is really remarkable. And one is asking, are there social behaviors in Asia and North America that have emerged, surprise you as people deal with COVID-19? And are there things we can learn from one another?
Again, no data yet. So things that surprised me, I think I already talked about that. This online gathering, like online social gathering, is really something that surprised me, because in the past it's like the online interaction is used for a very specific reason, right? So it has a certain function, like to schedule work, to discuss a certain topic. But this, like, people just hang out in front of a computer. I know some couples like who are in romantic relationship, they did this before the pandemic. From my research, I heard about that. But this a group of people, like wedding or funeral or just a social gathering, like Zoom parties on a weekend, that's something that really surprised me. Yeah, it's a new thing. And like whether the West and the East can learn from each other, I really don't know. I think one thing that we are very proud of, like here in Hong Kong, is that we have very self-disciplined residents. We, especially universal mask wearing. So that's something that we have been practicing for months. And we believe that's one of the major reasons that we got the virus under control. So in fact, if you think about it, universal mask wearing actually bring the physical distance closer. Like when I'm wearing a mask and run into a neighbor, and if that person is also wearing a mask, I feel comfortable talking to that person for a while. So you can still talk to your neighbor, talk to people in your community if both of you are wearing masks. So mask wearing can bring people closer. I think that may be something. But I know that in the US now, it's also like people are wearing masks. So
the other thing that surprised me is how quickly everybody in the community I live in has accepted the need to queue outside stores, stand a certain distance apart, and to only go in when somebody else comes out. And people are great about that. Nobody tries to push in, nobody whines or complains. Everybody has a mask. So I'm impressed by that too.
And I think, yes, we can be, I think, pleasantly surprised by the quick adaptation.
Right.
And it sort of, I think, gives us, some faith in the responsiveness of community.
And the strong social norms too. I've seen somebody in a line tell somebody else to step back. You're getting too close, step back, go back to the line. So there's a norm, a strong norm of proper behavior, and it's being enforced.
It's informal social control.
For the store.
Yeah, it happens so quickly, yeah.
Yes.
Yes, that's a great point.
Yeah.
So we only have a few minutes left together. Just the time goes so quickly. I wondered, Linda, if you want to start us off, do you have some kind of closing remarks or things that you hope our listeners can take away from this conversation in their everyday lives?
Sure. I think one of the things that's happened is with COVID-19 and all the press and all the concern and all the people whose lives have been disrupted, including healthcare workers, that I think we have more recognition of the vulnerable, defined lots of ways in our society, and that it's that the society has a responsibility to protect people who are vulnerable. So I think it's raised public awareness and consciousness, and maybe changed attitudes toward safety net programs of whatever kind. And I think that that's extremely important. We're all this, it's also, I think, made clear we're all in this together. All of human society around the globe is connected, and we're all responsible in some way for what happens elsewhere.
That's an excellent point. Ellie, do you want to?
I just think, yeah, Linda's point is great. And that's exactly what I want to say. I think if there's something that this pandemic can teach us, or what we can learn from this pandemic, is that we are very closely connected to our community. Like when someone was confirmed in my building earlier, everyone was so scared, right? So I totally agree with Linda. It shows that we're all in this together. So, and fortunately, we witnessed a lot of caring for others activities. Like people would share their masks, and they would share stuff, share information, and those activities, seems to be altruistic, but it's also for your own interest. So I think that's something that has become very salient during this current pandemic. Like when you are caring for others, you are also helping yourself, like help others and help yourself. Yeah, this sense becomes very strong.
Yeah, and we also had a caller ask about urban life and the extent to which it might change it. And so I think that's something we can all consider, how we imagine the role of density. Some ways good, I think, because we know one another and we're looking out for one another, but it makes some things like, right, the risk of infection higher. So perhaps we'll be able to pick up on some of those points in our next conversation, which will be in 2 weeks, in the 100-Year Lives in Asia series, where we're going to focus more generally on health and on life expectancy. I want to thank our listeners for joining us today, and special thanks to Professor Linda Waite and Professor Xiaoli Tian for really setting the stage for a wonderful conversation on social relationships in the context of COVID-19, and to think more generally about social relationships and the connection to community. So thank you very much.
It's my pleasure.